This week on Healthy Living, experts warn of the threat of meningitis due to low vaccination rates. Tanzanian internal medicine specialist Dr. Matabogolo Masalu discusses prevention and treatment steps for meningitis. And in our segment, Eye on Outbreak, Ghana declares the end of Marburg while Uganda fights with an outbreak of Ebola. Plus, a Kenyan-made device for premature babies helps to save vulnerable Ukrainian newborns. We'll have these stories and more in this edition of Healthy Living. Hello, thank you for joining us for another edition of Healthy Living. I'm Linor Moudou. The World Health Organization is warning of a resurgence of deadly meningitis in Africa because COVID-19 has disrupted necessary vaccination campaigns. Meningitis is caused by inflammation of the membranes surrounding the brain and spinal cord. It is often due to a viral or bacterial infection. According to the U.S. Centers for Disease Control and Prevention, viral meningitis is the most prevalent and least dangerous type of meningitis. Bacterial meningitis is rare and can be fatal if left untreated. Experts say acute bacterial meningitis can cause death within 24 hours and leaves 1 in 5 survivors with lifelong disability. Young children are most at risk. Bacterial meningitis can spread through food, but is often spread from one person to another. The Africa CDC reports that meningococcal meningitis caused by a bacteria is most prevalent in the meningitis belt of sub-Saharan Africa, stretching from Senegal in the west to Ethiopia in the east. Around 30,000 cases are reported each year in the area. The WHO and partners have launched a roadmap to stop by 2030 bacterial meningitis outbreaks in Africa.
The World Health Organization says people are at risk of meningitis outbreaks because vaccination campaigns have been disrupted due to COVID-19.
The COVID-19 pandemic has delayed vaccination campaigns targeting more than 50 million African children, raising the risk that these gains will be reversed.
The U.S. Center for Disease Control and Prevention says meningitis is an inflammation of the protective membranes covering the brain and spinal cord. A bacterial or viral infection of the fluid surrounding the brain and spinal cord usually causes the swelling. However, injuries, cancer, certain drugs, and other types of infections also can cause meningitis. Observers note that meningitis had been eliminated in Africa over a decade ago, after the deployment of the Menafrivac vaccine. However, some outbreaks have been reported in 7 countries since 2013.
WHO in the African region launched an ambitious new strategy, the Regional Framework to Defeat Meningitis by 2030. One of its priority interventions is the rollout of a next-generation vaccine that has been shown in clinical trials to be safe and effective against multiple forms of meningitis.
This vaccine holds the promise of finishing what Menafrivac began, such that Africa may be the first continent to be free of meningitis epidemics.
Dr. Moeti says the new framework aims to deploy the new vaccine in all 26 of the meningitis belt countries between 2023 and 2030, with the goal of 90% coverage. She also says the WHO does plan to have this vaccine pre-qualified by the end of next year.
Dr. Matabogolo Masalu is an internal medicine specialist at the Dodoma University in Tanzania. He discusses some steps to prevent and treat meningitis.
So the infection comes through the respiratory mechanism, but it goes directly to the central nervous system where it affects the brain and especially the meningitis, the spinal cord. It used to be prevalent before the vaccine as a preventive way of controlling meningitis, especially in children. The pneumococcal and Haemophilus influenza type B vaccine, the streptococcal pneumonia vaccine, and the Haemophilus influenza vaccine. So it's not that much common, but when it comes, it causes a critical condition. So in epidemics, there is a need of combating meningitis urgently because it may cause death in most of the population. There are several causes of meningitis: bacterial, virus, fungal, but the deadly meningitis is the bacterial one. But we use multiple approach when managing meningitis by using the broad spectrum antibiotics and also the dehydration by giving fluid and the other supportive management if a patient is having maybe convulsions or have lost consciousness. We have a multiple approach in managing a patient with meningitis. Usually the epidemics happens in an overcrowded area, like maybe the refugee camps. When it happens, we advise people to avoid the overcrowded areas. But the most advisable way of preventing meningitis, especially in children, is by using the vaccine. In adult, we also advise people to attend the clinics because some of the most of the adults who are affected by meningitis are usually immunocompromised. So whenever they are learned to medication and they have viral suppression, they are taking regularly the medication, so they can be in a safe way of not able to be affected by meningitis. The bacterial meningitis is the one which is deadly, and also the fungal infection, like in HIV patient, is deadly. So whenever patient feel unwell, by the symptoms, headache, fever, neck stiffness, or have seizures, convulsions, so they have to seek for health care so that they can be managed.
Uganda has declared an outbreak of Ebola after health authorities confirmed the case of the relatively rare Sudan strain. A 24-year-old man in Uganda's central Mubende district showed symptoms and later died. There are currently 8 suspected cases receiving care in a health facility. There has been 7 previous outbreaks of the Ebola Sudan strain, 4 in Uganda and 3 in Sudan, according to the WHO Africa region. Meanwhile, Ghana Health Services have declared the end of an outbreak of Marburg virus confirmed in July, a highly infectious disease similar to Ebola. 3 cases have been confirmed in total, of which 2 were fatal. The third was asymptomatic and recovered. It was the second outbreak of the disease in West Africa after Guinea reported a case last year. Finally, health authorities in Tanzania have issued an alert over the rising number of measles cases in the country. The Minister for Health, Umi Mwalimu, say they have recorded 54 cases of measles between July and August this year with no deaths. Experts say measles is a viral infection that is serious for small children, but is easily preventable by a vaccine. The disease spreads through the air by respiratory droplets produced from coughing or sneezing. Sweating may affect your entire body, or it may only affect certain areas like the armpits, the chest, and the face. Also called perspiration, sweating is the release of a salt-based fluid from the sweat glands. We asked how you keep yourself from sweating when the weather is hot. What do you do to stay cool when you sweat? Here are some reactions on Facebook. Siliro Muvunyi writes, when you are inside the house, you open the windows. When outside, you find some shade under a tree. Dylan Fazil says, I take a shower with cold water. Nipi Fiston writes, I dive in the river. Mugisha Samuel says, I drink cool water. Frank Dukuze Musali writes, of course, you search for a cool place. Gad Nyawe Nda says, I look for a banana leaf and I use it to fan myself. Sweating and body odor are common when you exercise or you are too warm. But it is often said that the smell of a person's sweat can indicate certain health conditions. Is it true or false? Experts at Harvard Medical School say this is true. They say sweat itself doesn't have a smell. The odor happens when bacteria come into contact with the perspiration released by the apocrine glands. Among other things, medical conditions such as diabetes, kidney disease, and bacterial infection, trichomycosis, have been linked to specific body odors, experts say. Also, stress activates the apocrine glands and can produce a vinegar-scented stress sweat. Furthermore, fluctuations in your hormone levels due to changes such as puberty, pregnancy, and menopause can cause odor changes that come through in sweat. Lifestyle changes like regular bathing and the use of antiperspirant and deodorants can help manage sweating and odor. If the smell persists, seek medical advice. Russia's war on Ukraine has seen scores of hospitals and clinics bombed and frequent power cuts that can turn off life-saving machines. Medical aid groups are using a Kenyan company's breathing device for premature babies that works without electricity, helping save vulnerable newborns in countries affected by conflict. Victoria Amunga reports from Nairobi, Kenya.
At this newborn intensive care unit in Kisumu, Kenya, nurses keep a close watch on at least a dozen babies who need oxygen support. Staff at the Jaramogi Oginga Odinga Teaching and Referral Hospitals say this device brings some relief to those in respiratory distress like this 6-month-old baby. The device is a bubble continuous positive airway pressure system, or BCPAP.
It has helped us a great lot because before we had the machines, there were babies who needed the CPAP, but we were not able to initiate. We were just using the normal oxygen. Yeah, but currently we have seen that there are babies who improve very well when we initiate on CPAP.
The device continuously delivers pressurized oxygen, making it easier for babies in respiratory distress to breathe. The device is being manufactured in Kenya. Reviral Healthcare, a manufacturer in Kenya's Kilifi County, and the US-based Vayu Global Health Foundation took on mass production of the devices this year. Officials say bubble CPAP just needs a pressured source of oxygen, such as a cylinder, to function.
So once you have a continuous flow of 100% pure oxygen flowing in, the blender, which is the magic of the entire device and is literally where the magic happens, is able to pull in ambient air from the outside as well. You can then adjust this oxygen concentration between 30% to 100% before being delivered to the baby. This blended air can be filtered, is humidified, breathed in by the patient, and breathed out, and then there's a pressure generator jar which controls the pressure and keeps the baby's lungs open.
Newborns are bearing the brunt of at least 400 attacks on hospitals in Ukraine, according to the World Health Organization. Officials say the device provides a non-invasive way of supporting newborns who are struggling to breathe. Doctors say oxygen blenders prevent lung and brain damage while giving babies pure oxygen.
People actually need to make budgetary commitments, and it means that health systems have to prioritize babies. I have found in my 2.5 decades of work on maternal health that there's sometimes a lot of talk around saving a mother's life, but at the end of the day, people aren't oftentimes willing to put finance behind saving a mother's life.
The BCPAP devices are available at a cost of $400 in Kenya. The system is being used in at least 20 countries in Africa, as well as Belgium and the United States. Nearly 1 million infants die annually from respiratory problems in low and middle-income countries, according to the WHO. Advocates say more of the life-saving machines are needed around the world.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at Linoch Mudu. Until next time, stay well and strive to make every day a healthy day.